Hi, everyone. Thanks for tuning in. You're listening to the Daily Apple Clinic podcast, The Truth About Health. My name is Paul Reynolds. My wife and I have an independent primary care practice in Denver, Colorado. We are nurse practitioners, having worked in a variety of healthcare settings over the past 20 years, and we have a deep desire to make healthcare better. Our goal here is to ask difficult questions and challenge the conventional thinking that currently exists in the healthcare space. And we especially hope to help all of our listeners think about their health and live better. We try to have fun too. Please check out the show notes below to find useful links and information about our guests. You can find us on the main social media channels, and you can always check us out at www.dailyappledpc.com or give us a call anytime. Here's what's in store on today's podcast. Welcome back to the Daily Apple Clinic podcast, The Truth About Health. Today, we're diving into a fascinating conversation that will inspire you to rethink health, happiness, and what it means to live a truly fulfilling life. Our guest is Marloes. Am I pronouncing that right?
Close enough,
Marloes.
yeah.
Nice. Okay. She's a Dutch native who has chosen a unique path with her family by moving to the French countryside, where they run a holiday rentals business. It's called La Source Bourgogne, something like that. Alongside hosting guests on their property, Marloes is also a life coach dedicated to helping people unlock their intuitive knowledge and find alignment in their lives. She believes in the innate wisdom of the human body and advocates for tuning in to what truly makes us happy and fulfilled. We'll explore her journey, her insights on rural living, coaching, and how the French culture has reshaped her perspective on life. And don't worry, we'll keep things lighthearted too, so sit back and enjoy what promises to be an insightful and inspiring episode. Hello, Marloes. So awesome to meet you and so awesome to get to experience this with you. We're pretty excited.
Yeah, thanks for having me.
We had originally talked about how you moved from the Netherlands to France. And I guess we'll go ahead and ask about, so just from your perspective, because you've accessed healthcare in different ways when you've been in both places, correct?
Yeah.
Yeah. So from your perspective, how are things different just between those two countries that are actually pretty close to one another in Europe?
Yeah. Well, I think you've also asked a lot of questions about how it was different from the US. And I think in Europe in
Right.
general, the idea that a lot of people have is that our healthcare is better, that it's free, and
Mm,
all those
mm,
things. I don't think there's things that I liked better in the Netherlands. There's things that I like better
mm,
here. In general, it's very accessible. I think the thing that's same for both countries is that no one should not have access
mm,
to healthcare. I think that may be the biggest difference with what I hear from the US. I haven't experienced it personally. I have family in the US. They all have health insurance, so I only know their perspective.
mm,
Although it is not free. It's not free in France, nor is it in the Netherlands. So there are countries where we feel it is a shared responsibility that every person has access to this, which I think is
mm.
really good. But it also has a high price. We do pay lots of taxes to make sure that
Right.
everybody has access to this. And then you can have, for example, in the Netherlands, it's basically private, so you're always paying for this yourself,
Ah,
and depending
interesting.
on how much coverage you want, it is more or less. Like if you want a high risk, for example, if you want the first 1,000 to be on your account always, your what is it called? The thing defined. No, what is it called? What you pay for your insurance will be much
Mm,
lower. In France,
right.
what's good in France is that they still have the system that we originally had in the Netherlands, which is very
Mm,
social, meaning everybody gets 70% coverage. Whatever your
okay.
situation is, most of that
Mm,
will be covered by your employer. They take a good part because I've had a big business in the Netherlands. So I know that as an employer, you pay a big deal for your employees. And then that's still the system in France. And then you can have
mm,
an additional insurance that's optional for the
mm.
remaining 30% that is not covered.
Okay.
And so did
When
both. Yeah.
when did the Netherlands switch over to this pay plan instead of more like France?
Yeah, it was,
Is
I
that
think,
recent?
no, that's when I just about when I started working. So that's
Okay.
25 years ago, I think. But
Okay.
it's still, I mean, it's mandatory. You cannot live in
Mm.
these countries when you have nothing,
Without
when you don't have any
mm.
insurance.
Mm.
Yeah,
And so everybody pays in pretty much. Yeah, something here in the United States that maybe, some people don't really they're not too aware of is we're all paying for it in a lot of different ways.
yeah,
We pay into a large percentage of the healthcare here in the United States happens through government plans, what we call Medicare and Medicaid,
yeah,
and plus some other stuff on top of that.
yeah,
Um, there is a large percentage that's insurance based, and some people go without insurance. Even they pay cash.
yeah.
So we pay a lot over here too, and so we don't get a whole lot of bang for our buck when you look at everybody all together and the people that end up paying a lot. The one program, the insurance program, tends to subsidize the government programs within the large institutions.
Hmm.
Yeah.
What I just hear from many people is that, oh, healthcare is free in France. I don't know
Mm,
why people think that is because it's not
right.
true.
Really?
And it's
How could it be
deceiving
free?
to keep saying, yeah, to
Yeah.
keep saying it. Well, even
Right.
if it weren't, like you said, even if it were paid by the taxes, it is still not
Right.
free. It only covers
Right.
70%. And it's up to you to
Mm,
have an extra insurance to
okay.
have part or all of that 30% covered. And that's very similar in the Netherlands as well.
So, are you happier? I mean, when you got to France, were you like, "Ah, healthcare is better over here. I'm things are working well." Because you were really an employer in both places, yes? Because you had a business there, and now you have your own business,
Yeah,
yes?
but not the
Mhm.
team
Yeah.
anymore. So here it's just me and my husband now.
Okay.
I
Yeah.
think that what I really like, and I don't know if I think in the Netherlands, there's a lot of pressure on the healthcare system. And if you ask
Mm,
any French person, they'll say the same thing. Oh, it's not what it's used to be. Like waiting times are
mm,
long. Sometimes you can't even find a doctor. Very similar to the situation in the Netherlands. And also
mm,
what we call here in France, they call it the désert médical. So the medical
mm,
deserts. So there's
mhm,
areas in France where no doctor apparently wants to move there. There's bigger
mm,
cities where all of the new, like those who've just finished their studies want to go. And there is
mm,
parts that is where there's fewer people. They don't even have they don't even have primary care doctors anymore. I have a friend. She
mm,
lives only 2.5 hours away from here. Is a smaller city called Nevers, and they have
mm,
a hospital, but they're flying in certain surgeons or certain specialists from
mm.
Dijon. So every morning or twice a week, a helicopter leaves from the hospital in Dijon to fly doctors to Nevers, and she can get
Right.
certain doctor's appointments that I can still easily get here. And we
Mm,
mostly our primary care doctor always makes me feel very warm inside, if that makes sense, because he is
sure.
one of the old school family doctors. He has
Ah,
an awful looking building. Many primary care doctors here, their clinics, you're looking at it thinking, really? Like it looks dirty,
right,
it looks old. That would be unthinkable in the Netherlands. It would all be clean and
right.
organized and well structured. Here you come into
Okay.
a very old doctor's office when piles of papers and dust and whatever. But our doctor knows, he knows all of his patients. And when you would
Mm.
call him and say, my neighbor's in trouble, he'll say, I'll come by this afternoon at 2. And that
Oh,
is
wow.
very, to me, that's, I remember being really, really sick when I was young and single and living on my own in the Netherlands. And I couldn't go to
Mm,
that doctor. And I called them 4 times. I can't even get out of bed. Somebody needs to come. Never happened. So I had to
mm.
drive myself to the doctor. And she said, that was irresponsible. I said, well, your assistant said you wouldn't come. And our doctor
Alright.
actually still does the house visits. And I think that
Okay.
is something that got lost in the Netherlands
Yeah.
and in many parts of France. But you feel like he still sees you. He doesn't have a computer, for example. So one of
Okay.
the things people complain about in the Netherlands is you come to your doctor in this beautiful clinic and he's looking at his
Mm,
screen and he's listening to you and all the while,
mm.
he's typing. And
Right.
I don't know if it's true, but I have a sense that some doctors And that's,
Mm,
the thing that I believe in is alignment,
mm,
being in touch with what you feel, being in
mm,
touch with the energy even of your patient, like truly connecting with them. If you
mm,
bring tech into that game, I
mm,
feel a lot get lost. So they're looking at their screen because they have that's the pressure of documenting everything. My doctor here in
right.
France, he asks me, "Do you remember what I gave your kid last time?" Because I don't know. He doesn't keep track of that. But it means
Yeah.
he's very aware. He's very present when we see
Mm.
him, and he'll remember what he did last time. Just sometimes he forgets what medication he gave.
Sometimes. Yeah,
Yeah,
so that's something they actually teach in medical school is to not look at the computer.
yeah,
Do we do that? Not so much, because in practice, um, it's much more efficient to be getting work done on the computer as you're talking to the person.
yeah,
And so most people resort to that efficiency.
yeah.
And so we have some new things that are happening in medicine. We have these things called co-pilots. They're AI designed, and what we do is we push a button, and it starts to listen to the conversation, and it
Mm,
will then write the note for you. It will listen, it will summarize, it will put all the information in there, and then you just finish it. Now you have to check it. It's not perfect, but that's a new thing that's coming out. And so what I personally do is what I discovered is I certainly don't wanna not face the patient. I wanna look at them. And so I just have a piece of paper. And as you can tell, I'm old. I'm 63 years old, and I
that's-
just like writing. I'm used to writing. That's how I learned it 50 years ago. And so I write. And so I'll just take quick notes. I'll ask some questions. What's going on? What's happening? And then I transcribe it verbally just with a program.
yeah.
And it seems to work pretty well.
Yeah, well, from my perspective, well, how I look at, this is what we wanted to talk about, how I look at how you are present
Mm,
with what you're feeling, how you're present with the
mm,
people that you interact with. What I know, for example, in the Netherlands, when our boys went to the primary school, they were 8 and 11 when we moved here. Our
mm,
Dutch schools are known to be very innovative. They did not
mm.
focus on writing. They had iPads. And I said, I like
Ye
that because that's where we're going. But I
Right.
do believe that the brain develops differently when you have
Mm,
your hand and vision need to work together.
mm,
It develops. I don't know if you're the doctor, you're
right.
this. I mean, I'm not the medical person here, but
Mm, mm,
something gets lost, I think. And also
mm,
just try to put yourself in the imagine yourself journaling about your intentions for a year, for example. That is fundamentally different when you
mm,
do it on paper rather than just in your head and maybe,
mm.
making a voice note of it in your phone. I mean, all of these have
Sure.
advantages. But I
Mm,
personally really believe in I believe and I appreciate the progress that we have, the technical
mm,
progress, the scientific progress in healthcare. And I also
mm,
believe something gets lost if we would only have that. Because
mm,
AI will give you what it's been fed, really. And,
mm,
the example that we shared in our conversations over email when my
mm,
son was very sick when he was young, and 5 doctors weren't able to find it, and the blood test didn't show anything. And I was like,
mm,
"This, who is going to solve this now?" And they did
mm.
everything they learned. They didn't make a mistake. They just didn't have the tuning in or the intuitive connection a mom has, I think. And I was the one ending up
Right.
telling them what I thought was wrong with him, which should never get
Yeah.
lost.
Yeah, not to diss on whoever your doctors were, but anytime you have some sort of an acute change like that, it's almost always an effective process, and we have 4 things. We have viral, we have bacterial, we have fungal, we have parasitic, and so that was one of them. And
Yeah.
so that was a box that just didn't get checked. Now, it is a fairly uncommon diagnosis, admittedly, but pretty easy to check for. Problem is we don't check for it, and it's a very specific check. We
Hmm.
to test for that, you have to do some very specific things to really figure it out.
Yeah.
So they just missed it. Really glad you had that intuitive sense that you were able to ask those questions and that you got that answer and followed up on it. And just trusted that. It's something, we talked a little bit about being able to connect and how that really doesn't happen very often in a clinician's office. And I would say that it is absolutely something, especially people who get into this field, it's a skill that can be developed 100%, but it takes quite a bit of work. You have to be very open to it and you have to be willing to let it happen. I use those words because that's how it has occurred for me is when I decide to do it, I just kind of open that space between myself and the patient and I I let them in. And what happens is I feel myself kind of move into them. I can feel what they're thinking, I can feel what they're feeling, and their words start to make much more sense to me. The
Wow.
patient will almost always tell you what's wrong with them if you will just ask, if you will give them the space to tell you that story.
Yeah.
And it's we live in a time no time for anything. No one over here really wants to give that time away when they're asking people to see 18 to over 30 patients a day. That only allows for 6 or 7 minutes in the room, and that's not time to hear really anything at all. And
Yeah.
so it's one quick diagnosis where we're doing pattern recognition. Tell me what's going on. Okay, that's what it is. This is how we're gonna treat it. See you later.
Yeah. Yeah.
And 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 then the real important thing is cha-ching, I get to charge for that. And
Mm.
that's the problem, is that it's, the way the system is set up, it's designed to generate income.
Which is good. I mean,
So,
it's valuable what you're getting from your doctor, so it should be valued. But
of
I think a lot
course.
of doctors are being pressured. The same as here in France.
Mm,
There's too few doctors for too many people. So that puts
mm,
pressure on the system. And I think the job
mm,
that a doctor would have, and I'm very grateful that our primary care doctor is like that, is okay, I'm not going to change my ways. I want to still be here. I remember my son needed something and it
mm,
was past his office hours, but my son
mm,
called because school called, like something's wrong. He needs to see a doctor. And he said, just come in when you come home. And I remember even the school saying to my son, like, do you realize how extraordinary this is that your doctor, like he's coming from his own living room
wow.
to see you for this. And I think that's,
Mm,
so there's lots of good doctors and there's lots of
yeah.
doctors that are trying to make the best of the
Mm,
situation. And this is just something we have to deal with. There is no judgment. I do
yeah.
think that what you're saying is a good doctor. I think sometimes we misunderstand what intuition really is. We think it's
Mm,
something that is very untangible or very
mm,
woo-woo, which actually there's been a lot of controversy about Malcolm Gladwell's work, but he wrote a
mm,
really good book on intuition. And really what it
mm,
is it is tapping into everything we know, everything we've
mm,
learned, every little bit of experience we had gets stored somewhere in our brains. We don't
mm,
always access it because we're using our I don't know what it's called, but the part of our brain where we're just like you're doing it, we're ticking boxes and we're ruling out things, and that's how we make a diagnosis. But we always have access to all of that information. So an intuition taps into all of that. And we sometimes say, oh, it's just a feeling. Yeah, but the feeling's not based on nothing. So as a
mm,
doctor or as a healthcare professional, you have access to all the patients you've seen, what you've seen during your training, what you've seen during your residency, what you've seen.
mhm,
And all of that is stored somewhere and you tap into it, you use it in with every person that you see. And that is just as much
mm,
intuition as what people have made it to be. And this is what I work with when
mm,
my clients are looking for answers about what they want in their life. Like a patient, and our job is to listen to that and have that intuition work for us because usually
mhm,
you'll have a gut feeling what it is, but
mhm,
scientific approaches in medicine, you can take the risk to follow
mhm,
your gut and not verify with the protocol
mhm,
that you have. And I think
right.
it needs to be a good mixture of the two. And I think good doctors use both. I know our
Mhm,
doctors do. And I love that when they use both.
mm,
I've got a sense it's something else. Okay. What do we need to do to check it then? I just tell
right.
people never ignore that when they're looking at me or
Mm.
someone that I love.
And now a word from our sponsor. Are you stuck in a job you absolutely despise? Does the sound of your boss saying, "Let's circle back," make you want to scream into a pillow? Good news, you don't need therapy, you need denial. Introducing the Stay and Suffer method, the revolutionary mindset that keeps you exactly where you are. Why chase your dreams when you can have paychecks and passive aggression? With Stay and Suffer, you'll get free daily stress headaches, unlimited access to office drama you never asked for, and a lifetime supply of awkward coffee machine conversations. So, ditch the idea of happiness and lean in to misery, because quitting is for quitters. Stay and Suffer, because a soul-crushing 9-to-5 is still better than figuring out how taxes work as a freelancer. This ad was brought to you by the Daily Apple Clinic podcast, because sometimes learning how to live healthier starts with laughing at what makes you miserable. How far away does your doctor live from you,
Oh, he's really only
roughly?
2 miles, like really in the next
Okay.
village. Yeah.
Okay. Yeah, but still, I mean, it's people don't do that over here anymore. I mean, I yes, I actually have made a few house calls here in the little neighborhood where we live, and it's kind of
Yeah.
the same kind of thing, pretty close. And we just wanted to be available for people, and so I put together a bag, and then I can just take care of people where they're at. But I want
Yeah.
to
Thank
kind
you
of
for
jump
doing that.
back to
Yeah.
yeah, for the intuition piece. Um, because you said, some people have lost the connection to their intuition,
Mhm.
and they have unlearned or have not been taught anymore to listen to their bodies. And I thought that was telling, because we all have these bodies, we live in them. How could we become disconnected from our bodies? How could we not know what's going on with ourselves? And you said that many people tell you that they don't feel that connection. And
Mhm.
I thought that was interesting. Tell us more about that, and maybe why you think that happens.
Yeah. Well, I've been working with people for almost 20 years, and they would come in and
Mm,
go, I'm not happy with this. And all of them would say, I don't know what I want, which to me
mm,
is never the truth. It
mm,
means you can't grasp it, but you always know what you want. We just need to teach you to be in touch with that again. But
mm,
I mean, I'm not that old. I'm 47. Yeah,
mm,
I think. Yes. And I think in the past 100 to 120 years, a lot has changed in our society. So a lot of the
mm,
things we're doing are with thanks to all of the progress we've made, which we still try and want to see as progress. We have been very disconnected with everything that we knew before, which is one of the reasons we moved to the countryside, where in some ways you're forced to be very connected with,
mm.
nature and cold and all those things. But I think
Right.
with our drive to make things more efficient, which I really applaud, we have become, in the Netherlands, we have this saying, we're a walking head. So we're a head with sticks, with legs. So we are overvaluing the
R-
power of the brain
the
and of
importance.
logic thinking.
Mm,
Exactly.
mm-hmm,
Which
mm-hmm,
again, I think is wonderful, but the entire school system, at least here in France and in the Netherlands, is based on that now. So there
mm.
is no
Interesting.
room for, maybe this child is more left or right brain.
Mm,
Everything's left brain. And if you're
mm,
not left brain, you're often misdiagnosed for something, I don't know, you may be thriving in a different place. So I think, and all of the work environments I've worked in, venture capital, strategic consulting, are very rational, left brain
mm,
environments, which I've learned a lot because I'm not a very good logical thinker. So I've really learned a lot there. But it's not all that we are. We can't be
mm,
one and not the other, because that's not how we're created. If you want to talk in terms of energy, it's feminine
mm,
and masculine. No life, or no one can thrive. No life can exist if we only use one. And I think we need to bring the balance back to using that feminine energy a bit more. And that is intuition, but it's not what we're taught. People are increasingly afraid to trust it. One of the good examples of that is, I'm Dutch. I had both of my kids at home, which has always been the norm in the Netherlands. You
mm,
do a home birth unless there is a medical reason for you to go to the hospital. You have the
mm,
choice to go to the hospital if you want. if you don't feel safe enough, of course. But the system in the Netherlands is designed with midwives that are very local, that guide you throughout your pregnancy, with all kinds of classes you can take to almost hypnotize yourself so you don't need any pain medication. You can do a perfectly normal, wonderful, unmedicated home birth. I
Mm.
saw that increasingly my friends or people around me are going, oh no, of course I'm going to the hospital. And to me, that was, why would you want to be in a hospital if you can have your child in your own bed in the safety of your home?
Mhm.
And one of the things I think I saw is because, yeah, we're not trusting our bodies anymore. We want a doctor to be there in
Mm.
case something, which is good because there are always risks. It's up to every woman to
And
think.
you had a very experienced person there with you both times, yes?
Yes, yeah, not all the time,
Okay,
but the first one that, yeah, she was there only for the
okay.
last 20 minutes or so, and yeah,
Really?
but yeah. And the second as well,
Okay,
actually, because I said, just leave us alone. We'll call you when we need you. But that was what
okay.
I wanted to do. But I think because I'm so in
Mm,
touch with the body, I sensed, I mean, we talked about this up front. I sensed that my kids were getting too big, that they wouldn't come out.
mm,
And I think there's so much value in what we know about our bodies. Like you said, your patients know what's wrong with them. They just don't have the language and the knowledge and the checklist that you have. So it's always an interaction between you and them. They need your
mm,
knowledge, but you need their feelings and their symptoms and their story to know what's really
mm,
going on. They can't put it all on your desk because you
mm.
need that information to make your call.
I would agree. Right. So we've referred to alignment. This is something that we actually, I think, sort of have on our website also. I think more in the United States, we would call this a sense of purpose. You describe alignment as doing what you feel you're meant to be doing with your life.
Yeah.
Sounds kinda like to me. And so and I would definitely agree with you. And you describe it as working with your talents, feeling like you're contributing to whatever's important to you, and that it's really this source of well-being for the individual.
Yeah.
How did you decide what how did you figure out how to be in alignment? How did you figure out what you were meant to do with your life?
Yeah.
And then next question will be, how do other people do that?
Yeah. Well, it goes back to being in touch. And I think when a child is born, it's very much in touch with
Mm,
what it knows it wants and what it thinks is good for them. I mean, anybody
mm,
who's had small kids knows that they don't really know what they want, and they'll let you know
mm,
as well. And then some of
mm,
that gets lost because we're taught that we can't always have it all. That and because when we grow up, we think we're getting smarter about life, but actually, in my experience, we don't necessarily get smarter about life. We have more
mm,
experience, yes, we have more knowledge, but we, like I said, we lose that connection. So,
mm,
for a lot of people, they need to be very much out of alignment before they realize that they are, because
mm,
they get depressed, maybe not straight away, but you just feel like, oh, I have the feeling there is more to life than this. Or you're
mm,
getting very bored with where you are when you feel like this can't be it. And most of my clients will say, like, I remember when I was a child, I was excited about things. Well, yeah, because that's how we're designed. We're designed to be
mm,
excited about things. We're designed to see life as a wonderful gift and to try
mm,
to get the most out of it. So as soon as we
mm,
are not experiencing that, and it can't always be great, but most of your days should be great. Like most of your days, you should feel like you're loving life. So a
mm,
lot of people have either an event. I've had car accident, ending up in the wrong jobs and almost being uh, incapable of working, which technically is still my situation. To see
mm,
that, oh, wait, maybe I can change what I'm doing in life so I feel better. Um,
mm,
and that's what I see with a lot of people. Burnout. I have maybe 80% of the people that I work with have had a burnout or having one or are going to have one.
mm,
And to me, that is the thing that shows us that we're out of alignment, because you literally burn your life energy away until there is
mm,
nothing left. And that's not how your system works. Like we're regenerating all the time. So even our life force, our energy should be regenerating like a battery. And if that doesn't happen,
mm.
well, we're very much out of alignment. And you can name it and explain it any way you want, but it's just feeling the life flow through you, life energy flow through you, and putting that to use for the higher good of all.
And this is something that we have internal control over. Certainly, we have external effect. Things happen to us in life,
Hmm.
but much of that is due to the choices that we make, and then we can choose to be more childlike, if you will, choose to be
Yeah.
more joyful. That we can decide what would be a smart thing to do and maybe a not so smart thing to do, and seek out the highest, best result for ourselves by understanding who we are inside and then choosing to develop those best parts of ourselves and then say, thank you, be grateful for having those things in our lives, and then really choosing joy because we have so much to be thankful for.
Hmm.
Maybe?
Yeah, but that's hard work. That's the
Yeah.
issue. It
Mm,
it doesn't
mm,
come naturally for most of us.
mm,
And when you're in a dark place, and it's annoying to be writing down, counting your blessings and writing down what you're grateful for, because
mm,
I mean, you're in this spiral that wants, I mean, that's what the brain does, right? You know this. The brain will
mm,
look for thoughts that are in line with the current thought I'm thinking. It's a train of thought that wants to develop all the time. So it takes a
mm.
lot of effort to break that
Yeah.
pattern. And it also takes a lot of courage sometimes for people,
Mm,
is what I've seen. I mean, I would have all kinds of people that I would work with in coaching, and some have responsibilities for I don't know how many kids. And yeah, I have had this client and he said, I can't do this to my wife because we have a beautiful house. We have all that she ever desired. And now I want to quit my incredibly successful business.
mm,
Yeah, that takes courage. And I think that is the constant game that we're playing. Am I
mm,
continuing because I feel safe with what I've created, or this is what expected of me? Or is this nagging little voice starting to have effect on our health, on our well-being? And are we willing to take steps to change things? But it takes a lot of
mm,
courage. I will never say it's easy.
mm. Yeah, that's the amazing thing about relationships is we have to share our lives. We get to share our lives, but if you start to feel a certain way, then that means you need to start a conversation and say, "Hey, I'm kind of feeling this way. What do you think about that?
Hmm.
Are these other things really important to you? Maybe I could use some feedback from you, this person who knows me really well, and maybe you could give me a sense of maybe what you just perceive or you see in me, things that have been happening, changing over time. And let's ask ourselves if maybe another direction might be a way for us as a couple, as a family to go. It sounds
Yeah.
like that's kind of what you did
Mm. Yeah.
in when you made your big change. And from the look of it, from the sound of it, it's really worked out well for you guys.
Yeah,
We're just so
definitely.
happy that you figured it out, and then you took the steps that you needed to change your life, your surroundings, your focus, the people that you live with, work with, the feedback that you're getting from the world, the air that you're breathing, the water you're drinking, the food that you're eating, and you said, "Wait a minute. It's okay here, it's survivable over here, but there's a better option over here." And
Yeah.
and and it's not just a little better, it's a lot better, and you actually described it as being a risky move for you. You were
Mm-mm.
worried,
Yeah.
you know?
Yes.
So, I don't know, maybe now would be a good time to tell us what was that like? What got you over the edge? What
Yeah.
what
Well,
what got you there, and then how did it turn out?
yeah. Well, I think that with all the things you've said, we're not alone. Most of us,
Mm,
fortunately, aren't alone. And if we
mm,
think we're alone, we usually aren't. We can always feel that we're alone. Sometimes that's not true, but I do think, and I've been often attacked for this, but I do think we need to put ourselves first, because in the end, when you um, take away everything, we are individually responsible for our own happiness and our life. No matter what you say, I'm married, I have 2 kids. I still am personally responsible for what I do with my life. I'm just trying to make it
Mm,
work with the people that I love. So, and what I saw with a lot of other people around me is that, no, but my husband this, or my partner this, or my mom,
mm,
I can't do that to them. So, and to me, that is not being authentic, because I like
mm,
to be as authentic as I am, especially in the relationships that are with people that are closest to me. I don't want to pretend to be somebody else with my husband, because I trust that we'll always find our way out. If I tell him I want something different, I mean, if we really love each other, we'll figure that out. But and
mm,
that is all related to my personal story, which I haven't really shared a lot about, but I was in a car accident at 19, 20, and it had a big
mm,
impact on my health in my early 20s, but I needed to survive and made a lot of wrong choices just because I needed to financially be able to support myself. Um, but it did hurt me health wise. And so I was very motivated at some point to say, listen, I don't care what anybody else thinks. I need to take care of myself now. So that
mm,
got us on a really nice track. And I built my business and I met my husband. And at some point we both just felt, okay, we have it all figured out. We have a beautiful house. We're married. We're happy. We can go on holidays a couple of times a year. We have kids doing well in school, but we are not meant. This is what I believe. You don't have to agree with me. The universe
mm,
is expansion. Everything expands. I mean, you don't even have to be woo-woo for this. You could just ask any astrology, not astrology, astronomist.
mhm,
He'll tell you, or she'll tell you, that the universe expands. If we are part of
mhm,
that universe, it means we are expanding. So if we are just a bunch of energy vibrating within
mhm,
energy vibrating, it means that we're expanding. So what I often
mhm,
see with clients, and it's exactly what happened with us, like our energy is expanding, but we're keeping ourselves in boxes most of the time because we don't see ourselves as big as that. We just think, okay, we're having a life, we're having a job, and this is what we are. But when we don't move with the evolving soul that we are, we usually feel out of alignment, or we get sick, or we get
mm,
depressed, or we get a burnout, all the things that you probably know. I personally feel they're related to, okay, your soul, or the real you, or the child in you, whatever you want to call it, knows there's a next thing for you to move towards, but you are not moving towards that. So that's the essence of getting out of alignment, because here's your soul, or your bigger you, or the bigger knowing, or if you are religious, the way you were created by God, that is evolving on a beautiful path with the support of whatever it is you believe in, God, source, or whatever, nobody. It can be that as well. But you're staying
mm,
here. So this is evolving, and you're keeping yourself in the safety of this job and this country, and oh, this school for the kids. And this has to get, to a point where it's out of alignment and where it's starting to hurt. And that's what
mm,
happened to us. I said, we can go on until we retire, but I don't want that. My husband actually didn't
mm,
want that either. He got in a burnout. And I
mm,
said, quit your jobs. It was like unthinkable to him at that time. It was about 3-4 years before we moved. So why would you stay in a job that makes you sick? Like literally makes you sick.
mm.
Hmm. Well, he wasn't taught that that was an option. So he
Right.
gave up his job. I had a business that we were building still, with lots of things going on in the Netherlands. It was easy if we would stay in the Netherlands. Very challenging tax wise. And don't get me
Mm,
started on France. And there's no entrepreneurial support in France from the government. But still,
okay.
we want to move on. We feel like we need to take this step. And so we took a lot of risks in letting go of our old life, financial stability,
Mm,
letting go of that, jobs, pensions, like everything that we
mm,
were building in the Netherlands, we let it go to come here
mm,
and start over. Um,
mm.
but
Thanks again, everyone, for tuning in to the Daily Apple Clinic podcast, The Truth About Health. Please click the share link and make our content available to friends and family. And don't forget to click the subscribe button so you'll get new episodes delivered directly to you as soon as we release them. As always, your comments are welcome. Please do your best to be kind and include ideas that will help everyone as they think about their health. You can always find us through our website, www.dailyappledpc.com. Give us a call anytime if we can answer questions or be of assistance. Here's a short clip to give you a taste of what's in store on next week's podcast.
I think when you think you know it all, you got it all, you've seen it all, is when you stop growing. And I always say you might as well die, because that's when we're done. That's when you're done here.
Take good care and see you next week.